Headaches can be a huge pain, but for some teens who get an extreme type of headache, it's an even bigger problem. Tyler has the story.
When Daniel Beecher complained about constant headaches, people thought he was making excuses, but his headaches were real and more severe than normal.
I had it for like a week straight. I was having like 2 a day.
That was during the summer. Then school started, and Daniel's headaches began to really get in the way.
I'd have to be in like a dark room, away from light, away from like noise, because that only makes the headaches worse. So I really had to step aside and for like at least an hour and just let it subside.
The headaches were affecting Daniel's schoolwork, so he and his mother went to the North Shore University Hospital's Headache Center. There, they met Dr. Noah Rosen. The doctor discovered that Daniel's headaches weren't just headaches, they were migraines.
Well, a migraine doesn't feel like a typical headache. It can feel like a throbbing, an exploding, a crushing pain. It can feel like nothing else that you've ever experienced.
Migraines also tend to occur on only one side of the head, and the biggest sign that you have them is if they interfere in your daily life. This all matched Daniel's symptoms, but even his mother questioned them.
I ignored it probably for a good year and a half. It started out when he went to camp, and I thought he was not adjusting well, so I said he was making excuses. But then a year and a half later, I said, I think this is more than just an excuse.
Like many boys, he's been told that, first off, adolescents don't get migraines, and also that it's a problem only with girls. And both of those are untrue.
What is true is that girls are more likely to get migraines. Boy or girl, the pain can be really bad.
I couldn't stay in school and I couldn't concentrate, I couldn't spell, I had word finding issues, and so I had to go home and go to the doctor.
When we treat migraines, one of the most important things to keep an eye out for are the triggers of the headache.
That means finding out what causes your migraines. Some common triggers are stress, caffeine, dehydration, weather, skipping meals, and for girls, the menstrual cycle. Even if you avoid the triggers, you might still get migraines. In that case, a doctor may prescribe medication. Unfortunately, studies show that most teens don't seek the treatment they need.
When the pain is severe, it's not the right thing to ignore it, because ignoring the problem can make it a lot worse. And it's important that people go to their doctors so they can get the diagnosis and the appropriate treatment.
And with that treatment, life can go back to being normal.
I don't have to worry about going out during the day and worrying if I'm going to have a headache or not.
If you think your headaches might be migraines, don't try to tough it out. Get help.